Okay, so good evening to all. Welcome to Real Talk, our usual Monday evening program. And Real Talk, has been really a program, social media program brought to you by the United Workers' Party, targeting various audiences, including the young persons, demographics, and generally Dominicans at large, both here, home, and abroad. And it has been maybe our 15th edition of this program. And what this program intends to do is to feature different persons with different backgrounds, work backgrounds, people with Dominicans here and overseas as well, our trained Dominicans overseas, whoever. It's just a matter of an information window in terms of bringing out what is important to our development, including education, tourism, and everything, health, whatever it is. And this program has been successful, and we always say that we actually welcome all those who have been participating and giving their comments, because without your comments, without your participation, then this program is like nothing. But as we always say, respect the views of others and make your comments respectfully by not trying to put down somebody else. And so tonight we have a good program concerning our health system. And with me tonight we have our honorable leader, renowned economist, Dr. Thomson, Fontaine, political leader of the United Workers' Party. And we also have with us a distinguished son of the soil, medical doctor by profession, Dr. Dale Dangeben. But before I introduce Dr. Dale Dangeben, I usually have a little talk with the political leader who always gives us a little update as to what has been happening. And so, political leader, welcome tonight. You look bright. I know after the big rally, you have had that soft throat and you are healing, progressively. So we admire that. So what can you tell the viewers? How has it been since this great, massive rally?
Well, good night, Soso. Good night to you, and of course to our many listeners, and as well to Dr. Dangleban, who has graciously agreed to be with us tonight. Yes, since having this tremendous rally on the 1st of February, persons are energized. I've had occasion to talk to many people since then, and everybody's feeling great, and the vibe is good. There's a kind of excitement that is building, and everybody refers to it as momentum, and I tend to agree. And it's something that is really going. I was in Montrachet earlier today.
Wow.
And the persons who did not come said they regret not having made it, because they were looking and they saw the size of the crowd and the people who were there, and they wish that they could be a part of it. We got similar sentiments when we were at Woodford Hill. A number of persons over the weekend, they were there on Saturday, meeting the people of Woodford Hill, and a similar sentiment was expressed. So I think I can safely say that our people are feeling energized. They understand now that there are a number of persons who are truly dissatisfied with where this country is, and they are standing up strong. I was particularly pleased with the number of persons who previously voted for the Labour Party and who stood with us. In one particular case, I met a lady in town. I think it was on last week, I think Thursday or something. And she began telling me that she came to Grandford, that she has voted 3 times in her life. 3 times she's voted for the Labour Party, but enough is enough. And she was speaking sufficiently loud that people could hear what she was telling me, and people started stopping and nodding their consent, basically accepting what she was saying. And she told me, she went further. She said, I stood in front. I made sure that I was picked up when Imo swung the camera on the crowd. I made sure I was strategic. I placed myself so everybody who knows me will know that I was in Grand for supporting the United Workers' Party. So with those kinds of testimonies, I think we're on the right path. I think people are listening to our message of hope. People are very happy that we are not spending time necessarily just bashing, but we are spending time promoting what we plan to do for this country. and there is hope. And that's the reason why even tonight we are looking at health, because it's a big issue, especially for our diasporans, those in the diaspora who want to come down. There are huge concerns they have about health. So tonight we get a chance with the great doctor to talk about the health system in Dominica, and just to continue to offer that hope that the people are so happy about. So yeah, we are very, very pleased with the impact of the rally, and we are certainly moving forward confidently.
Yeah, thank you, political leader. So I'll go right into introducing Dr. Dale Dangabel. Before I do so, let me just read a short bio of a well-accomplished medical doctor, and it's my pleasure tonight to welcome Dr. Dale Dangabel. But before so, let me just say, right, so about Dr. Dale Dangabel. Dr. Dale Dangabel is a board-certified trauma and critical care surgeon with extensive expertise in trauma, surgical critical care, and acute care surgery. He currently serves as the Chief of Surgery and Trauma Medical Director at Penn State Health Holy Spirit Medical Center in Camp Hill, Pennsylvania, where he also leads as the Director of Surgical/Trauma ICU and Acute Care Surgery. A dedicated academic, Dr. Dale Dangabel holds the title of Clinical Associate Professor of Surgery at the Penn State University College of Medicine. He is a published author and editor, having written multiple textbooks through prestigious publishers such as Springer and McGraw-Hill. He serves as editor-in-chief of the Surgery Journal, FIEM, and was section editor for surgery in the SNCCM Journal and the chief editor of Caribbean Health Awareness Magazine. Dr. Dangabel previously held the role of Director of Acute Care Surgery at Wellspan York Hospital and held key academic and clinical roles at Lehigh Valley Health Network, where he completed his residency and fellowship training. Throughout his distinguished career, Dr. Dale Dangabel has been recognized with numerous honors, including the 2022 Physician of the Quarter Award from Penn State Health and the 2019 Humanitarian Recognition Award from the Dominica diaspora community. His commitment to clinical excellence, mentorship, and community service has earned him acclaim in both academic and global health spheres. Beyond the operating room, Dr. Dangabel is a passionate advocate for healthcare, equity in underserved populations, particularly in the Caribbean and African American communities. He continues to champion public health awareness, medical education, and cross-cultural health initiatives. Dr. Dangabel's enduring commitment to excellence in medicine, education, and advocacy marks him as a respected leader and visionary in the field of surgery. Having heard this, Doc, and the many listeners, Dr. Dangabel, I want to welcome you to this program. A very good night to you, sir. How are you? How have you been doing?
Good night to you and Glenroy Cuffy, Soso, and Dr. Thomson Fontaine. It's really an honor, pleasure to be here. It's been a while, but I'm here.
Right. Well, straight into it, though, Doc. Straight into
Absolutely.
it. You know, the healthcare system in any country serves as a crucial component of any nation's overall social framework, positively impacting the well-being of its citizens. What is your assessment of our own health situation in Dominica? Because it appears that many persons have their view, and knowing that you have been involved in the whole medical sphere, being a talented neurosurgeon and doing what you do and doing what you know, you have visited our hospital. What do you make of us as a country ready to stride forward in healthcare?
Yeah. Well, that's a very interesting question, and I was asked that question in 2012 or 2013, the first time I came on Q95, and that opened up a whole can of worms back then. But I will say the same thing, how many years later that I said then, that I give the system an F. And I continue to do so to this date, because I think if you look back historically in the 80s at the Dominica health system, it was actually, we could boast about it. There were several papers written about, preventative health care in Dominica and how great it was. And to see how far we've gone down that hill, it's appalling, because I look at the system based on what I have seen personally. I've been to the hospital many times, and also from the amount of people that reach out to me on a weekly basis, right? Just this weekend alone, I had 4 people reach out to me. So all this information that I have gathered through the years, and the interaction or the lack thereof, I think points to a system. I don't know if it's deliberate to control the masses, but the healthcare system in Dominica is a failure. And there's a lot that needs to be done to come out of that hole, to fix it. The basic things are not there. And when people come forward and try to help, it's refused. So you have to put that into context of why is that the case? Is that deliberate? And then you have to sort of look at the structure, the hierarchy of this health organization that we in Dominica, and decide what's the issues and how do we fix it. And I have some solutions that actually I have presented to the UWP in the past, many years ago, and also to the government, to the hospital, in terms of how certain protocols and certain standards can be put in place.
Yes, and it is important that you mention, though, that when people volunteer their free services with respect to the expertise that they have and earn, and that they are refused. And as you say so, it comes to mind that, yes, our health system has been undergoing many challenges, including shortage of professional persons. And the persons are actually, and those who are trained, people like yourself and others, I know Dr. IP himself has been doing such a great job as well. And many of our professionals out there who have the expertise and they are willing to actually contribute and have been refused. It tells me that we are not ready, because the point is, there are many reports pointing to the many deficiencies that we have respecting to sort of our dongs, our what they call it, even say our outdated infrastructure, our shortage of medical professionals, high prevalence of non-communicable disease that is threatening us, and so many other areas of concern. And is there an explanation for this, doctor? Why is it that persons like yourself have been rejected when you volunteer? Hear the word volunteer. You're not asking for a job. You've got a job. You are volunteering to assist, and you could be well needed in certain areas, because I can tell you the number of deaths we have. I'm not saying you are God, you're not going to save everybody, but there are things that you could do. Why is it so hard that because someone doesn't support a government policy, that the government doesn't see fit to take on that person?
It's part of, and this is not conspiracy. This is fact. This is part of a bigger agenda. And when you have governments that lacks focus and vision, these are the things that happen, right, in order to control. So folks like me, they first of all, I was labeled part of UWP very, very early on in the process, even when I was just, going through the channels of understanding, Dominica politics after all these years. So once they have you in that channel, they view you as against them and against their political agenda, right? And that's what it is. So I think most of the physicians that I know that have come back to Dominica and left, right, is because they were pressured out of the system. And they've tried to frustrate me in that regard, but I never gave up, because I really do care about Dominica and the people. But getting back to your question, I think it's deliberate. It's part of the control system. A lot of dictators, etc., across the Caribbean and across the world have used this method of controlling, because they don't want strong-minded, intellectually, strong people to come in to see the wrong that they're doing, to challenge them. And that's why you see a lot of puppets around the current government who are not functional in their roles, including the healthcare system. Right? I tried to have a discussion with the Minister of Health a year and a half ago, when I sent down the mammogram machines, and it was an okay, conversation. But then when you dissect any health organization and how it's structured, you ask yourself, how does an engineer fit in that mold, right? As we try to fix this healthcare system. And again, I don't want to go too far from the question that you asked, but I think it has been orchestrated in such a way that it turned out the way it is, because you talked about physicians and nurses leaving Dominica, right? But at the same time, you have millions and millions of dollars for hotels, right? Think of what that money could have done in terms of retention, in terms of recruitment, one, and retention of good doctors and good nurses to stay on island, right? But they don't care. They let these folks just walk away because they felt that, they can get folks from China, they can get folks from Cuba to fill in those spots, but not seeing the bigger picture of the continued brain drain of these professionals that we need, right? And I think therein lies the problem. And I could keep going on and on about why the system is the way it is, but the problem is we really don't have a healthcare system, man. If we talk about trauma, right? Dr. Thomson Fontaine talked about his experience over the weekend. I was on radio today. We talked about trauma. But if we have to talk about, for example, cancer, the different types of cancer, there's no cancer database, right? We don't know. We see all this drinking, all this partying, but we don't see any information on cirrhosis or liver disease. There is no data. And a healthcare system and a healthcare organization that is well organized would have all that. And from that, as we know, therein lies the research that would make things even better to get us back to where we were in the 80s in terms of, preventative care. But none of that is being done. None of that is being done. And everything is for show, and folks are not listening. I saw the board and the administration of the hospital. They met last week and they had a press conference. It was good. I listened to it. But what happens after? What happens the next day? Right? What are we gonna do? We don't have we have a lot of prostate cancers, but we don't know the incidence, right? We don't know what's going on in Dominica. We have people dying, young people dying. We see the rats running around. We don't know the incidence of leptospirosis, right? These are the things that is important in terms of fixing the healthcare system. Instead, we have 30 to 40 people on the roadside in one little area chopping up grass. And I'm not putting that down. I'm just saying that we're not structured in what we do. We're not training young people to be, medical assistant, to be, phlebotomists, right? To run labs and things like that. We're not putting people into these technical and vocational skills, because everything in Dominica now in the last 15 years is for votes and not really for growing the country the way it should be grown.
Yes, so therefore I'm going to come to Dr. Fontaine now. I like what you said there about the, to be data driven. We have to have that in terms of directing our whole health first, because without data you cannot plan. But Doc, it is not surprising that you have Dr. Dangabel here with us, because you, as the political leader of our party, you have always said that you are going to get the persons who have trained, whether locally or overseas, with the expertise to actually get into nation building. And you, as the political leader of our party, in your 10-pillar plan, health is an important aspect of the whole development of bringing back Dominica. Your views?
Yes, so indeed, health, I can't say it enough, how critically important our health system is. That is going to be a key determinant or key factor in whether or not we're able to attract our diasporans back home. And what happened to me last night, coming back home from, actually on Saturday night, coming back home from Woodfordale and having been engaged as I was with seeing someone literally die from an accident, and knowing and understanding what our health system is all about. It was really frightening. I mean, and for those who've not heard me, I think it's important to relay that story. It was, to me, it was very, very disturbing in the sense that I was just, on my way home and we came upon an accident. And here it was, this gentleman was lying next to the vehicle. I went across, checked him. He had a pulse. He was breathing. He did seem to have some visible injuries. The driver was unscathed, apparently untouched, but because the vehicle had flipped over completely. And we stayed with this. I called the ambulance, called the police. About 30 minutes, the ambulance came after about 30 minutes or so on. But all this time, I was with this man on the ground, not knowing what to do, and wishing that I was in, because I have seen stories in the States when you can call 911 and they will ask you questions and they will kind of walk you through what you can do in the meantime until you can come. None of that. I was asking, the vehicles will come passing through, asking anybody, shouting out, is there any doctor, any nurse, anybody that knows that, medical person that can come and assist? And, so we decided not to touch the individual and until the ambulance came. But I was completely shocked. The ambulance got there and they immediately, without even looking at the guy twice, just flipped him over on his back because he was lying face down.
Right.
Flipped him over on his back, put him on the stretcher, put him into the ambulance. 40 minutes later, he was dead. So it tells me that something about that picture has haunted me since Saturday. I was able this afternoon to visit with the family. I actually met the driver. I went to the home of the driver as well to console with him, knowing that's a very difficult time for him and what he has experienced. I was able to talk to the sister and the brother and couple, actually the son as well of the deceased. I also was able to talk to them and console with them, explain to them what I saw, his last few minutes and so on. But it really brought into sharp contrast our health system, because in 2026 we do not even have a functioning ambulance. Afterwards, I had a conversation with the police officer because poor fellow, one police officer came after about 10 minutes after the call. He arrived there by himself and not knowing what to do. He was busy on the phone trying to call. I said, but I've already called the ambulance. They're on the way and so on. But afterwards, I had a chance to talk to him and he told me, this is the latest vehicles that we have. I said, but you don't even have a first aid kit in there. For example, if the person was bleeding, isn't there something that does give you, like you can stop pressure and stop the bleed?
Stop the bleed.
Not even that. He says, no. He says, that's the newest thing we have. And there was nothing. Like I was completely hopeless, helpless. And I'm saying something's wrong with that picture. We absolutely have to do better with our health system. And I'm glad Doctor is here with us because he has been advocating for just this kind of thing, where we can do better, where we have this. And not only that, was Saturday night. The night before, we had two other individuals die within 5 minutes of the hospital in Roseau. Two other persons die in an accident right there under the cliff. So we are losing people. And I'm of the firm view that some of these persons can be saved and should be saved if only our health system measures up. But it is appalling what we have and what we are passing as a health system. And
Yes.
and I know Dr. Dangleben has been talking about it, and I would really like him to weigh in, to continue to weigh in on this.
Oh, yes, certainly. And that is why I was coming to that question after, but I'm happy that you actually brought it up, Doc, because I was about to ask Dr. Dangleben, and let me just commend him for the work that he's done in the past, because I was about to ask him about telemedicine, because I know in most of the African regions and many regions where you cannot really access, or where people cannot really access healthcare, because doctors are too far in, and they use remote methods like telemedicine to communicate. And Dr. Dangleben, if I'm wrong, you could correct me. I know when Dr. Sam Christian had his incident, you were instrumental in staying on the telephone to actually get them to stabilize him the way he's supposed to be stabilized before he could travel. And there we had success. You were not even on island, but here we had success. And I'm not saying you're alone, but it does a link. You talking to other medical professionals, Sam being a professional himself, and you were able to get with the collective vibes of telemedicine, your vibes are rolling in, able to get Sam safely out of Dominica, and now Sam is okay. Doc, is the prospect for that? Because we are lacking so many things, basic things. When are we going to reach there, though?
You know, it's interesting because before we move ahead, I want to talk about the Dr. Christian situation.
Yes.
You know, it was not a formal telemedicine consult. As a matter of fact, they wanted to know who leaked the X-ray, right? And I was on trauma call in the hospital when I got the X-ray, and I know Dr. Christian would not mind me talking about this.
Yeah.
I called and I said, this is what we call an open book, blah blah blah, fracture tab. And I gave them the information in terms of what they needed to do based on that X-ray. So that was telemedicine, but they wanted to know, instead of them saying thank you, they wanted to know who leaked out the X-ray for me to get involved in that incident. And there's a little more to it, but there is always a role for telemedicine. But I don't want to stray.
Right.
In terms, I want to get back to what Thomson was talking about and what he witnessed, because these things, are very, very traumatic. Because I could, if you're not used to seeing that, I mean, I've been doing this for 25 years and I'm used to that. But when you're not used to seeing folks, injured like this, and it really takes its toll, on you, and it can be traumatic. But what we need in Dominica, before we get to telemedicine, we need basic EMT and paramedics trained and certified in Dominica, right? And another thing is when you encounter a patient in the scene, right, based on the accident alone, you should be able to get an assessment of the type of injuries, right? And for example, I'll give you an example. This patient had blood coming out of the ears. If a patient is in a motor vehicle accident and they have blood coming from it, that's what's called a basilar skull fracture. Wow. That means they have a fracture at the base of the skull. So that means they have a head injury, also, right? Especially they have what's called the raccoon eyes, the blood around the eyes, blood coming from the ears. So there's a little things. If somebody has an open knee fracture, did they hit the dashboard? So there's a lot of things that you can gather from the scene even before you touch the patient and move the patient. And that's very, very important. And what was very disheartening in this situation was just throwing the patient. And I've seen that so many times. I saw a picture 2 years ago. I forgot I think it was either Wesley or Lapin. They had the guy on a piece of plywood and running with him into the clinic. And that guy ended up dying also. Like this, we acting like we're in the bush with nothing, to do. And we have multi-million-dollar facilities going up. So in terms telemedicine, yes. And even if I'm on the phone or I'm on a telemedicine system, I'm telling you what to do. And what you need is a hospital with a surgeon. Telemedicine does not cut it, especially with trauma, if you know what I mean. So if you have a very difficult, infectious disease case, a cardiology case, and even a cancer case, telemedicine works well there. In terms of trauma, I think what we need to do, and I said that on radio today, is we need to build a command center. One. Dominica only needs one, right? One command center that takes these calls, right? But you need functioning ambulances with all the equipment to take care of this patient, right? Police comes, yes, but you need an EMT. You need not just a driver of an ambulance. You need somebody in the back to put the oxygen on, to put an IV and start the IV fluids. There's so many things that can be done to save a life, right? And these are the important things. There is something that came out of Hopkins and shock trauma many years ago called scoop and run. But that means you get the patient quick into the trauma center. In Dominica, you don't have that, right? So you need functional EMTs, trained EMTs to get to the field, assess the patient, put them on the longboard, put a cervical collar on. We have tons of cervical collars in Dominica now that I have brought and made available. I have enough collars here for the next 10 years, right? So the point is we have these things available now, but we have to put it into a system. We have to put it into a system. And somebody called today and said, well, people need to be trained. Yes, people need to be trained. Give them the training. Take half of the people that you have cutting grass by the road and train them to be EMTs, train them to be phlebotomists, to draw blood, teach them different skill sets that we can function in the healthcare system. But no, we're training people to cut grass, we're training people to carry trays in hotels, which is, I'm not knocking these things. I'm just saying that the healthcare is so important. Without proper healthcare, you don't have a nation, you don't have a strong country anymore. And that's what you're seeing. Young people are dying. We used to have people dying in the 80s, 90s, 100s. Now you have people in their 30s, 40s, and all we say is rest in peace. And we go on MO News and we comment. We need to do better. We need to do better. Dominica needs a medical command system, an emergency system, right? And remember, that is not just for motor vehicle accident or gunshot,
Right.
What if somebody's having chest pain and having a myocardial infarction or heart attack? And the biggest thing that I did not talk about on radio today that I want to bring to light, because Thomson was there. This patient went to St. Joseph. What's in St. Joseph? What's in St. Joe? Do you have a receiving surgeon? Do you have a nurse anesthetist or an anesthesiologist that could put this patient to sleep? Why go there? Right? So
only 2 nurses. I found out today there were only 2 nurses.
Right. So it's upside. You do not take someone who had a major motor vehicle, was involved in a major vehicle accident, who's unresponsive, having difficulty breathing, having blood coming out of the air, and take them to a clinic with a nurse. Think of what you're doing to the patient, and think of what you're doing to that nurse, right? So we need enough of this political nonsense that these guys are playing, right? And they think of me as the enemy, when all I've been trying to do is help this system to do better in that emergency room, right? How many surgeons are in Dominica? I can tell you, people are not surviving major trauma in Dominica. I heard about one of my classmates, a very good friend of mine from SMA, he used to work at DBS. I heard what happened to him. You cannot bring people, and that's another thing, man. There's so much I could talk about, and I want to express this. It's one thing, we do the EMS system, right? We bring the patient to the hospital, but there also has to be a system as soon as the patient gets there, right? If you activate the trauma that's en route, you activate the trauma, and then you decide what you're going to do. You're going to fully assess the patient, right? X-ray has to be done immediately. We have, and I'm not comparing this to what the state of the art we have here.
No, you don't.
But X-rays should be done in a timely fashion, right? I see orthopedic surgeons packing patients in the hospital for weeks on end and waiting for money to fix their broken bones. They come to me, asking me for the screws and the bolts, right? That is not a system. That is not a system. Dominicans need to wake up. They need to really, really wake up and say, you know what? Yesterday was this person. Tomorrow it could be me or my mother, my father, my brother. And we need to do better. I am not saying that any of these patients would survive, but we have to give everyone a reasonable chance. You know what I mean? The only time we pronounce a patient is if it's blunt trauma and they have the pupils are blown and they have no heart rate and blood pressure, and it's greater than 5 minutes for blunt. If it's penetrating, if it's a gunshot and a stab wound and it's greater than 15 minutes without a pulse, then you could do the assessment and call it. But otherwise, you have to give everyone a fighting chance. Right? We have 100-year-olds, we have 90-year-olds falling, breaking their hips up here. You're not going to say, oh, this person is 90-year-old, we're not going to take care of them. No, we have a system. We have a system. And guess what? Tomorrow, I'm meeting with my performance improvement coordinators. They meet in my office once a week. And we have criteria of all the patients from last week. Every single one of them, we review. Right? Okay, surgeon X or did X did this, he needs to respond. He or she needs to respond to why they did this, and this. So we have a process. And then we have what's called peer review, where everybody meets and we discuss all modalities. It's a process. And everything I see in Dominica is just, political noise from these folks. And to the point where, I say I'm persona non grata. I know you guys are on the ground dealing with the hardship. But it's like I'm an enemy for trying to improve something that's broken in Dominica, right? I have ventilators now I have ventilators in Point Michelle. They know about that. So if they need an extra ventilator, they know where to come and get it. I have all kinds of stuff down there. I have AEDs, which to shock patients. I have that on the way, right? So we bring these things to the island. We make them available. We know where they are. And what I'm not going to do, and I will say it very boldly here, I'm not giving it to them. I want them to know it's available for everyone, because once I give it to them, they will do politics with it. And it's for Dominicans, whether you UWP, whether you Labor, whether it's for all of us, right? So everybody gets a fighting chance. I heard about the man who had the heart attack in I forgot the village, but they never came. The guy was there holding his chest, and no one came. It's hard, and you see all these young people dropping too, and it makes you wonder. Do these folks really love Dominica? Or is it all, $1.8 million for Champagne Beach came out last week. And that's all well and good. I'm from La Pointe. It's all well and good, right? 1.8 million, but the people up in Union Estate has not had their garbage picked up for weeks. The ravine where 16 or 18 people died, that wall, I have been campaigning about this. I'm ready to do it myself. Has not been fixed. If a hurricane like that comes down again, that whole floodplain, people were wiped out in Point Michelle, right? Why is there $1.8 million for Champagne, and that wall where people died has not been fixed for 8-9 years, right? So the system is broken. And when we react and we do things and we smoke in mirrors, we put out a bouillon song and we try to distract people with alcohol, we need to open our eyes and say, you know what? We need a healthcare system. We need a better healthcare system that when I fall down and I break my knee and I break my foot, I have somebody to take care of me, right? When my appendix bursts, I don't have to. People are dying from appendiceal rupture in Dominica. Something that takes me 10, 15 minutes to do up here. You know what I mean? You're sending people home. There was a young guy from Loubier. They sent him home 2 or 3 times. The guy died from a ruptured appendix. That's unacceptable. Right? So these are the hard conversations. So, I know I strayed Soso, but telemedicine is all well and good. I have 2 telemedicine towers sitting in Point Michelle right now. Towers. With the camera and the speak, everything. Wow. I sent it down, right? But the thing about it is, do they want to work with Dr. Dangerben? Oh, that guy with the opposition, he's anti-Dominica.
Mentality problem. Yes, and we're getting hot there. It is very interesting, yeah? And so many great points. And another aspect, Doc, because you come in, because you as the politician here, you get the subtle questions, because I know that you talk about health insurance, that is an aspect you're looking at. Because one guy brought me his sad story some time ago, and he told it to me, and he said, look, I was at the hospital, he had a fractured leg. And then he said to me, so he's in pain. And a doctor came up to him in the hospital, and the doctor told him, well, for me to start working on that leg for you, you have to find $15,000. $15,000. But I was feeling emotional already. The guy met me, told me his story. And I said, $15,000? He said, yes. The doctor said, for me to start. Fine. So here it is that this guy got an injury, none of his fault. He fell, he broke his leg. He went to the hospital to get just basic primary health care. And here it is that he's been told to work on that leg is $15,000. But I'm going to ask the next question, but let me put the preamble to this. So the public healthcare system structure in Dominica is primarily composed of government-funded hospitals and community clinics, which are strategically located to serve both urban and rural populations across the island. That's a given. Notwithstanding, the private healthcare sector in Dominica encompasses a range of facilities, including private hospitals, outpatient clinics, and specialized care centers, which offer advanced medical services that are often not available in the public institution. So the question is that, people say, and those that have the money, they will say, well, I'd rather go private doctor because one, I get a personalized patient care. One, they have shorter waiting time. They don't have to wait all that time. They have been attended to. They have more direct access to medical professionals. They have a higher nurse to patient ratio because obviously the nurse in the public hospital has so many patients to attend to, but at a private doctor's office, he may have an assistant nurse or nurse, and that if you need one or two persons, the nurse can be more efficient there. You have a higher level of satisfaction because you can talk to that doctor privately, and you believe that the level of confidentiality in respect to what you discuss will be even more secure there. But the question is that the way to go? Because there might be a case where subsequently it may be left for more private operated hospitals as opposed to the private, because we're losing confidence there. But there are limitations as well and constraints where the ordinary Dominican does not have the money to actually foot the bill and to pay for his own medical system. Gentlemen, the question is, are we ready to actually put medical attention or care in the hands of private practice as opposed to beefing up the public sector and the public health system? That is the next question. So, Doc, you could hit on this one.
Well, we have two docs here. You have which doc?
No. Sorry, Dr. Langeman, go ahead. Go ahead. Go ahead. Yes.
So, we have to. If you put things into context, in terms of money wasted,
right,
that could have been achieved, right? It could have been achieved in the last 20 years by allocating some of that squandered money towards health, right? But in terms of a system, some of it has to be subsidized by the government. And I think it's just like up here, the Medicaid, the Medicare system, right? And if you want to get into a private insurance type for certain, but Dominica, at this stage that it is in terms of the economy, I don't think can afford that. Okay, I don't think you can afford that at this point. You would have to have a lot of doctors coming together and building a separate system and making it work in terms of having all the subspecialties, having radiography and everything else to make it function. But where do you get your licensing from? You get it from the government. So that in of itself is a deterrent for people to invest significantly in those channels to make things better in Dominica at this stage, right? It's like everything else that the government has to sign off on. And I think to build a new hospital, you have to go through all this other, the health minister, who obviously functions under the direction of the prime minister, and all these other things. So I don't think Dominica is ready for that in its current state. And Dr. Thomson can talk about, the financial aspect moving forward. But the problem we have is how the funds were used, right? Like to build a 20-something million palace, right? To use 100 million, 75 million, for a hotel in La Coco, right? Just imagine what that type of money could do, right? And another thing, I don't want to go too far without getting back to that 15,000.
Yes.
The typical charge, and a lot of people come to me with their broken bones from Dominica, and it's usually between 12 to 15,000 just to get the surgery done, right? And they don't stock the plates and the screws on island, right? Now, if you have a significant fracture with all this crazy riding and driving around, and you have an open fracture up here, you have 24 hours to wash it out, appropriate antibiotics, or otherwise you're dealing with infection and you're dealing with the loss of limb. So in that in of itself is a failed system where patients go home with broken bones and have to come up with the money and things like that. So it's upside down, and there's so much discussion, right? And I think that's where UWP and the opposition has to come, when they come in power. I'm not saying when they have to really sit down and say, you know what, guys, how do we fix this? Because there has to be some subsidizing of healthcare, by the government, and where that money comes from, that's another issue, and that's another discussion.
Yes, so Dr. Fontaine, I know that, yes, the health insurance system is a good thing to talk about, and many persons may be questioning, yeah, it's all right, good. The funding of it is something else, but it is something that you envisage and see that because we lack the actually necessary funding, especially poor people are not able to get that medical care that they need to stay healthy. Probably you're going in the right direction, and probably you can help assist us with what has been asked.
Absolutely. And Dr. Dangleman makes an excellent point. You absolutely have to subsidize, government must subsidize the health system. And you ask where the money is going to come from. Well, we just spent, as I said, 75 million on a hotel. All right. Imagine that money in the health system, building up our health system. And then we have where we can attract now health tourism. We can attract persons from overseas to come and do their operations and so on in Dominica.
Right.
I will tell you so. It became frighteningly, it was frightening.
Yes.
When we were over the weekend, as we did our house to house and so on with the people, the number of elderly people that told us directly, they said they have already told the family, if they fall sick, do not take them to the China Friendship Hospital under any circumstances. Let them die at home. They're not going to that hospital. I mean, the numbers, and it just grew on us. And we said, but wait a minute, it seems like every other person we speak to who is in a certain age bracket are telling us that. So it means that they're serious because they're hearing the stories, they're hearing the horror stories, and they're saying that they want nothing to do with this hospital system because we have not done very well. We have heard of the compromised care. We have, we talked earlier about the first response kind of thing, but you're talking about getting into the hospital and getting the kind of care that you need. It just does not exist. So what we have committed to under our 10 pillars is to build a first-class health system that will make use of our doctors, not only in Dominica, but over. And that's where the question of telemedicine comes in. That's where the question of embracing of people. It took Dr. Dangleman about 11 years, I believe, Doc, right, to get a license to operate in Dominica. Dr. I.P. Pascal, one of the best surgeons, ear and throat surgeons, was denied. Dr. Ricketts was denied use of the hospital. Whereas that is routine, where private doctors, they're able to work in the public health system because they add value to it. But in Dominica, that has been discouraged. And it is mind-boggling that they have gotten this so wrong. So what we will do is that we will rework this whole health system where government contributes significantly to it, but also the accessibility, because you don't want to build something that people do not have access to. And then to make it more accessible, we will build, along the lines of what they do in Antigua and Barbuda, a national health insurance system where every person will have health insurance so that when they get sick, they don't have to worry about the money. I met a guy there, in fact, when I came to your opening there in Point Michel, I met a guy who told me that he fell and broke something and it cost him, he went to England, to Guadeloupe. He told me it cost him 50,000 euros. 50,000 euros for the operation. He says, yeah, I'm back together, but I have to get 50,000 euros to pay for it, out of my pocket. So this is what we have in Dominica, and this needs to be fixed. And that is where I believe, that is why we are paying so close attention to this health sector, because we believe that it can be fixed. You put the money into it, you get the personnel into it, and you do it in such a way that the confidence comes back. Because right now, confidence in our health system is at an all-time low. People are saying, let me die at my home, let me not go to this place. And it is very sad.
Yes, and then so we come now to that burning question now, because with all what have been said here, and we can understand this is the reality of it. So people are ailing, they do not have the means to probably get well or to get a good quality health care, treatment or attention. And here comes the burning question about mental health now, because we have a lot of persons who are actually, undergoing now serious mental health issues. Some may not be aware, some may be aware, and again, lack of the outpatient clinics or out-district clinics, and lack of mental evaluation by persons not voluntarily want to go forward to know if they have mental health issues. But the whole idea that the ministry, the public, health system doesn't actually make it mandatory that we have monthly, mental health evaluations. Again, because maybe we don't have the personnel again to attend to this. But Dr. Dangaben, this is something that is frustrating. And I don't know if when you walk around Dominica, you notice some people are walking, but they are lost. And, all that is part of the start of the depression. And some people actually going off. And as we speak right now, we do not even have a psychiatric hospital. We have what they call a psychiatric unit. And it's now overburdened because right now the facilities that are present there, they are not sufficient to take care of the person, the number of intakes now. And when people come in, because they want space for others, then they do not get the quality health care that they deserve, mentally or psychiatrically. And so they go out now with almost not really getting the proper treatment. And sooner or later, they are back in. Doc, I know we have been talking about a sort of decay or decaying health situation, but even mental health, I want to focus on that.
Yeah.
What is your take on this one?
Yeah, I have spoken, quite a bit, and I usually online on social media, I usually refer to Margaret Wallace, who's a, yes, Dominican trained psychologist. But I had some schematics that I did 2014, 2019, and I think I shared it with the UWP and a few other people.
Right.
And part of the central carved out area was mental health, and that's important, and that has gotten 10 times worse. Yes, walking around Roseau, not just Roseau, every community now, and it's not just it's been dismissed as drug use and everything else, and we don't even have a proper drug rehab. We don't even have a drug rehab program. But what I was getting at is Dominica is such a niche, natural beauty, right? If you looked at where I designed to put the mental health facility, it was not in Roseau, it was not in Portsmouth, it was in the central part of the island, right, where people can go and literally like a retreat and have the social experience and meet with the psychologist and the therapist and have conversations with folks. So it can be designed in that sense. But what has happened is more young people getting depressed. There's more suicide. There's more drug use. And people say, well, you don't blame the government for that. But guess what? It's the system of poverty. It's the system of telling people that they're not good enough, that foreigners are coming in every day to take their job, emasculating, young men and destroying young women, that they can no longer deal with the psychological burden and everything else that's going on in that country as it decays. So we're going to see a huge spike in mental health issues. As a matter of fact, I spoke to Margaret Wallace several months ago, and I said we should go to Dominica and do a mental health conference, and she can testify. She can testify to that. I'm not just making that up, right? That because I saw the need. I saw the need in Point Michel. I saw the need in Roseau, right? I saw the need in Grand Bay. And again, folks are just walking with their heads down now, and it's just it's heartbreaking. So in terms of mental health, we cannot just dismiss that. But I wanted to touch on something else that you talk about, what Thomson talked about the people don't trust in the system. Remember, that in of itself is a psychological burden. Look at what happened in the United States, with the history of the Tuskegee experiments and everything else. We're still dealing with that psychologically, right? So it's going to take a lot for people to come back and gain a trust into the healthcare system. And we have to build, useful things, not just what we see in Dominica, building stuff for votes. We have to build a facility for mental health and mental issues with the therapists and the psychologists, right? And psychotherapy and pharmacotherapy in an organized way to treat people, to get them back to where they need to be. But we cannot talk about mental health in Dominica without talking about fixing the economy, making people feel useful again, because that's the most important thing I think that's happening. People have been brought down to the lowest level, and they feel that all they can do is party and drink.
Yeah, so let me just take some of our comments there. We have mortality reviews are crucial to help the system learn lessons to decrease the chances of certain problems recurring. We can do better. We must do better. We've almost become in love with RIP. I suspect that's rest in peace. It's shocking. Yeah. So, Doc, I mean, you've heard, I know you have your own assessment of Dr. Fontaine, I know you have your own assessment of mental health here. And again, the health, system, we know is in sort of disarray. And that's why you make it your business for 10 pillar, for health to be part of the 10 pillar plan. And just some time ago in a town hall meeting, you said, look, we have to take mental health seriously because it is something that is escalating. And that's where we are.
Yes, indeed. So the shocking incidents, man. I mean, every village, every single village you go to, you see the young men that are like zombies, and a few days ago, we were in one of those southeastern communities there, and you just see this guy just like literally just staring into nothingness and just standing one place and you get that all over the country. We have a serious crisis on our hand. We have a mental health crisis on our hand. It is growing, and as the economy worsens, it's becoming worse because these are young men in the prime of their lives. And I say young men because that's the majority. It's also impacting on the women, probably in a less visible way, but it is also taking its impact on the young women because these are young men at the prime of their lives who see no way out. Certainly not a future in Dominica, who maybe cannot move out, and the frustration builds up, and we have this situation. So we are in a mental health crisis. I'm told that the mental ward is filled to capacity, and they have no room, not enough room for people and so on. So we're in a very serious situation, and this absolutely has to be dealt with. But again, we have government that is not caring about its people. And what will it take for Dominicans to understand that this government cares but for themselves? And I think that is very obvious, because when you have one individual building 2, 3, 4 mansions, one is not enough. I need to get another and another and another. One individual taking $64,000 off the taxpayers for himself every month, when his salary is probably 12, 15,000 EC dollars. That tells you that something is wrong with this country and with our governance. And people accepting this. It's almost like people are, I guess they're so overwhelmed that they will accept this. But that is something that we need to do something about. We need a wake-up call in Dominica. We are losing our young people through mental illness. We are losing our young people through accidents and an inadequate healthcare system. And before you know it, we're going to be left without any people here in Dominica because we're losing them. People who can actually contribute meaningfully towards this country. And so we need to do something. I don't want to be alarmist or frightening to anybody, but that is the reality that we're faced with. And the reality we are also faced with is that we have a government that simply does not care about the people of Dominica. And the quicker that people understand that, is the quicker they will take action to ensure that we change this government and we do what is right.
Yes, and we do not have time on our side, but we are coming to the end. But I know Dr. Dale Langeben, earlier on, he spoke about, we need to sort of establish data-driven approach to directing our healthcare system, which is good because until such time, what is happening in that quantity and that quantity, you're not able to prioritize what you want to do, and that's good. And just in the latter there, he spoke about a health conference, which we really want to see, taking place, because that would be good when you have a number of health professionals with different backgrounds come together and have a health conference. That'd be good to do this. But Dr. Langeben, more to that, at the school level, we may be neglecting that part of it. And as we spoke about mental health earlier, we know that about young people with peer pressure, they go home, sometimes they have nothing to eat. Some of them come to school without anything, and that builds pressure. Don't you think too that we could start advocating and having, what they call, psychiatric evaluations and even probably mental health evaluation, and also discussion,
Yeah.
at the school level, probably that can help.
Absolutely. I mean, anything like that, could help. One thing, and I'm no expert in mental health, but I will tell you this. When I came to this country, my view of mental health is totally different than what it is right now. Because again, I think historically, this machoism, this I call it toxic masculinity that I possessed. Let me just put it on me. When I came up to the United States, I think does not help anyone. I think some of that still lingers, in the Caribbean, how we view ourselves, as men. And here comes, political people that now emasculates, men, right? That emasculates men and take the manhood away from them in that sense. What do you think that does? That makes things, 10 times worse and makes the mental issues worse. So I think the focus has to be, yes, education, but at the same time, investing into the facilities to treat these folks, and not just a ward. I know Thomson talked about the ward, but not just a ward, but talking about a location where folks can really go and be taken care of in that sense, because mental health, it's a huge spectrum. And like I said, I think at some point you guys should get Dr. Wallace on here, to have a conversation about that. There's so many things, right? We talk about depression, but there is bipolar disease, there is all kinds of stuff. There's narcissism, there's psychopathy, sociopathy, and all these other things that ranges in that. And we see a lot of that, and we just say, oh, that this one is on drugs, this one is on drugs, and I think there's a lot of schizophrenia in Dominica. But again, these folks, and bipolar, by the way, and these folks are being dismissed. So we need to get back away from some of that historical stuff, burden, that we carry, right? I had started writing a book a few years ago, right? If you suck your thumb back in the day, or you peed in bed, what did they do to you? There's a lot of things that happened, historically, that we have to go get out of that trauma as Black people. And then here we have it with a government that doesn't care and make things worse with poverty and alcohol and everything. It's the perfect storm. So getting back to what you asked, I think it's important to have conversations with the children, but I think to have psychiatric evaluations in the school, you have to tread very lightly in terms of how you go about these things, especially in Caribbean society.
Yes, and thank you, Dr. Dangaben. And in fact, indeed, Dr. Margaret Wallace did say, yeah, so we have to put psychiatric aspect into the conversation, and we did that. So, Doc, maybe next time we should have Margaret Wallace with us.
Yes, well, she is listening. We can extend an invitation to her next week for that.
Oh yes, certainly. We have the expertise, and I know she actually, I know, I was about asking the question, so I saw her comment, and it was just timing. So, gentlemen, the clock is against us, and we have come to the end of our program. But let me ask the question, and you both will react. Are you all optimistic that things can happen? I know under United Workers' Party government, we've known the problems, so we just have to get things rolling. But are you optimistic that things can turn? Because as it is now, because we are really in dire strait, gentlemen. We're in dire strait.
Yeah. But I'm very hopeful. I believe, based on the conversations we've been having with people over the past few days and weeks, people are becoming increasingly hopeful that change is coming. People are now willing to make the change. At the start, we talked about the people who were upfront, saying, yes, here I am. I'm prepared to vote out this government. More and more people are coming around to that. So we're extremely hopeful that there will be enough of a change, because people are realizing that this government clearly does not care. This government stopped caring a long time ago. It's about its survival. It's about being in office at all costs. and people are beginning to understand that it's not working for them, and that I think is very hopeful. People are prepared to do what is necessary to make a change in this country, and we are very optimistic, extremely optimistic.
Yeah, you have to be optimistic. I mean, I always say, a little bit of paranoia, but optimism has gotten me where I am today, and that's just my nature. But looking at how bad things are in Dominica, the last time I went down, I talked about it. I think you have to be optimistic. Like how far down can you go? And like Dr. Thomson Fontaine said, I think now is the time. And I like what they're doing, going house to house, meeting people. I meet folks. I just don't show it on social media. I talk to the young people, because I think they need. That's all they've known, man. It's this system this mess these guys have created, and they need to sit, and then we need to sit with them and tell them, you know what, there is hope. Show them other ways. Like I said, when I went down, my kitchen was my lab. Right, wow. I made gummies, I made capsules, I made so many different things, and I brought people, and you show them how there is more to that. You can build them up. You can see their eyes, especially young folks, their eyes open up, and they can see that there is more to this. There is more to what these guys have lied about, right? And we have to open their eyes in that regard. So there is hope, and we have to be optimistic. And when I think of my people like my father, right, who called the radio over and over till his dying day, or people like Patrick Delaney and all these folks, we have to be hopeful, right, so that this is not in vain. And as long as we have the voice and we have the strength, we should push forward for Dominica and let folks understand it's not about party politics, right? It's about saving a generation. I'm not going to tell you guys how old I am, but we have passed that stage. We're doing it for the next generation. We have to save them, and we have to sort of echo that and tell them, you know what, we're doing this for you, and it's time that we break the chains of Dominica and what these guys have done to Dominica.
Thank you, Dr. Dildang. One thing we know about is that you are aging young, so we understand that. And
no, Dr. Thompson looks younger than me. He taught me in high school.
You seem to have the recipe and you know how to stay young, but that's good. So let me just thank you all, gentlemen, for tonight's program. We have been talking. This program has been aired as Real Talk tonight, and we were honored to have Dr. Dildang and our esteemed political leader, Dr. Thomson Fontaine. Let me just say, as we continue to bring information across different, sectors in our society, we want to say that we need your support, and we are saying that without your support, we cannot go anywhere. So it's all good to have these programs, but and the energy to keep us alive, you need to patronize financially. So our mobile banking ID is 555-2242, and your account number is 1005636. And you can visit our website at uwp-dominica.com, click on donate, and here you go, you give us something. Because it is all of these monies that cause us to have that grand rally. And we want to thank you, for the work that you have been doing. So, gentlemen, and all who have been listening, all who have participated this evening, we want to say thank you again for participating. And Dr. Daniel, I'm Dagban, I know we can get you at any time. Wish you well. You are doing a great job. May God bless you and your family, sir. I salute you. Dr. Fontaine, I salute you. Have a good night.
Good night, guys.
See you next time.
Good night.
All right.
Thank you.